Okay, so today we're going to talk about extracorporeal blood oxygenation and ozonation, addressing inflammation at the blood level. We have a special guest, Dr. Barry Moon, who his clinic has been performing this procedure for quite some time, and he's absolutely extraordinary. He has a background in applied kinesiology and chiropractic medicine. He practices in North Scottsdale off of 101 and Frank Lloyd Wright, and he serves the entire area here. He's a phenomenal practitioner, very holistic and integrative in his approach. He has a lot of cool modalities at his practice, but one that I found particularly beneficial for me has been EBO2, and we're going to get into it today now. I'll explain what that is and how it may benefit you. So what exactly is EBO2 and how is it different from like other IV ozone therapies? Because there are several other ones out there. That's a picture of me actually undergoing the procedure with his rock star stellar nurse, Krista. I can't control the slides.
Sorry, I thought that we were going to go into question and answer. So are you going to go over what exactly EBO2 is?
Yeah, I was gonna go through the slides and then we're gonna do questions and answers at the end. So um
So this is a question for Dr. Moon?
oh it is, okay.
Yes.
So Dr. Moon, can you explain what exactly EBO2 is and how it's different from other IV
You bet.
ozone therapies?
Yes. So EBO2 is extracorporeal blood oxygenation and ozonation. So it differs from like a 10 pass and standard IV treatments due to the volume of blood treated and the filtration device that we use. So just kind of roughly a 10 pass will move a little under 2 liters of blood per treatment. And then the EBO2 will move about 2.5 to 3 liters of blood per treatment. So, and the biggest issue or the biggest factor is, like I said, the filtration process that the EBO2 has versus the 10 pass or any of the other ones do not.
Great.
So, go ahead.
I was gonna say like with the 10 pass, what happens is you take the blood out, right? And then you physically mix it with ozone in a bag. Is that correct?
Yep.
Right.
Yep. It's in like a kind of a bubble, and then it's under hyperbaric oxygen, and then it flows back into the body.
Right. But
Yep.
with EBO2, it's a whole different process.
Yes.
So here you can see Krista starting an IV on my right side. She's going to put an IV on that side. The IV will take my blood out. Like Dr. Moon was saying, several liters of blood will go out and it goes through a special filtration process we're going to get into in just a minute. Then it comes back in my left arm. And so it's almost like dialysis, but
Yep. Exactly.
yeah, but yeah, it doesn't take out everything. So it just takes out toxins and mold and other bad stuff in our body that we'll talk about in just a minute. Okay, we can go next slide. So the key behind this is that 100 kilodalton filter, right? And what does it actually remove from the blood? Well, it's been tested. This is nothing new. This has been around for decades. And what it removes are viruses, bacteria, parasites, if you have any, mycotoxins, which come from mold, for example, microplastics, which we've learned that every one of us has a significant amount of microplastics throughout our body, including and for males in their testes and for everyone in their brains. So this can actually help detoxify our body from microplastics. It also helps remove heavy metals from our body and excess lipids. Now, results may not be typical for everyone, but I've undergone 2 treatments of EBO2 with Dr. Moon in his clinic, and I've gotten lab work done after each one, and both times my lipid panel has been the best it's ever been. I don't take statins, I don't take any medications, but and my cholesterol has always been like borderline, but after my treatments, it was the best it's ever been. Now, I'm not saying this is going to be a therapy for high cholesterol or hyperlipidemia, but it's just something that I noticed, and I have empirical evidence from my blood draws that show that it actually improved.
It was awesome.
Yeah.
A couple things I can add with that, the 100 kilodalton filter. So just for example's sake for people, so anything larger than 100 kilodaltons stays behind, anything smaller gets passed through. So for example, like a small virus like the polio virus, it's around 8,000 kilodaltons. An influenza virus would be considered a medium virus. That's 10,000 to 20,000 kilodaltons. And a large virus like a herpes virus or a pox virus is 50,000 to 100,000 kilodaltons. So just kind of, for example, there, it catches a ton of viruses, and the bacteria itself, they're millions of times larger than the 100 kilodaltons. So basically everything gets trapped that you don't want in the bloodstream.
That's amazing. Yeah. Okay. It's great to know. So why does the body respond so strongly to EBO2?
So it comes down to oxidative signaling. Ozone creates kind of the mild controlled oxidative stress in the body. And that stress acts as a signal that upregulates the antioxidant enzymes, has immune system modulation functions as well with increased cytokine signaling, improved oxygen utilization. So it increases your liver detox pathways, mitochondrial function, cellular repair process, and has antimicrobial effects as well. So that basically it destroys the microbial cell walls and renders them more susceptible to cell death by your white blood cells and those kind of things.
Amazing. So it's probably good to do preventive, of course, but then also if you're fighting a virus or a bacterial infection, it may be a good option to help speed your healing process.
You bet.
Right on. That's great. So how does the EBO2 strengthen the body's own antioxidant system?
So through kind of the same means that I was saying earlier, it's through the controlled oxidative stresses. So it upregulates the antioxidant enzymes, which are glutathione peroxidase and superoxide dismutase. So those are essentially the superoxide dismutase targets the free radicals. Glutathione peroxidase is your biggest key antioxidant enzyme. Its core role is it protects the cells from neutralizing harmful peroxides. So those peroxides build up due to inflammation, environmental stressors, toxins, radiation. So when those get too high, if they build up too high, those peroxides, they can damage DNA, oxidize cell membranes, impair proteins, and contribute to chronic inflammation and overall disease.
Amazing. And so real quickly, guys, you can see this contraption here on the slide. So that big filter thing with the blue top and the orange red bottom, that's the actual 100 kilodalton filter that's basically filtering my entire blood as it goes through there, and it's trapping all those viruses that Dr. Moon was talking about, bacteria, viruses, and all the toxins get trapped in there. And then it's sent through the machine for oxygenation, ozonation, and then back into my body. So what happens to oxygen delivery after EBO2, Dr. Moon?
A couple things can happen. Big one is improved oxygen utilization. So red blood cells, when there's inflammation, infections, too many antibodies in the body or in the bloodstream, they can tend to clump those red blood cells. So what ozone does that's kind of unique is it unclumps or breaks apart those red blood cell clumps. And then so they're able to go do their oxygen transport a lot more efficiently throughout the body. So another big one would be improved microcirculation.
Yeah.
So ozone helps increase nitric oxide signaling and capillary blood flow. So better microcirculation, you just have better oxygen delivery, better glucose, fatty acids. So increased ATP production, many, many factors.
Fantastic. Have you ever combined PEMF with EBO2?
Combine what, sorry?
PEMF?
I have not actually.
Okay, because PEMF is pulse electromagnetic field therapy. A lot of my clients are doing this regularly. And PEMF has the same anti-clumping effect that you described, like that EBO2 has. So I was wondering, maybe do some PEMF, unclump your blood cells, and then do EBO2, and then
Do it at the same time, just have them lay on the mat while they're doing it.
or at the same time, exactly. Yeah.
Yeah.
Yeah, I know of some of the wellness clinics that have PEMF, PEMF along with their IV therapies. So
Okay,
Yeah, kind of get a double dose there. Uh,
absolutely.
So why is nitric oxide so important in EBO2 therapy?
So that controls your blood vessel dilation. So nitric oxide basically tells the smooth muscle to relax. So it increases your blood flow, lowers blood pressure, improves oxygen nutrient delivery, supports your exercise performance, endurance, supports sexual function, muscle function, immune defense, enables nerve signaling. Very, very important in the body.
Yeah, it actually, yeah, it improves cardiovascular health, cognition, for great for brain health, and then also for sexual health in both men and women.
You bet.
Mhm. How does EBO2 affect the immune system without overstimulating it?
So essentially, ozone doesn't rev up the immune system like the way of an infection or a stimulant does. It's that low controlled ozone exposure that creates the mild stress signal that kind of tells the body something's happening. Let's increase regulation and improve the readiness. So it's on the same core pathways like hormesis. So it's not a direct stimulation. It's essentially a little bit of stress makes the system stronger. So too much stress can damage it. So too little stress, the system can get weak and sluggish. Mild short stress is kind of what we're after with the EBO2. The system adapts and improves, but excess or prolonged stress, the injury burns out, you get disease in the body. So,
Great. Yeah. So how does ozone help with infections and microbial load? I mean, we kind of talked about this already, but if you want to go into any more insights,
yep.
that'd be great.
So it can damage the bacterial and cell walls is a big one. So it renders them more, susceptible to the body removing them. Oxidizes fungal membranes, interferes with the microbial replication. So, and like I said before, with the load, I mean, the viruses, the bacteria, microbes, they all get trapped into that filter and they're removed from the bloodstream. So therefore, they can't continue to replicate, and in turn decreases overall load in the system.
Right. Yeah. I mean, like I said, from my own personal experience, I've only done 2 sessions. I did them a few months apart, and knock on wood, hopefully I'm not jinxing myself, but I haven't had any infections that have manifested symptomatically in over a year. I mean, all throughout 2025. I think the last bad infection I got, if you want to call it an infection, was shingles in
Okay.
July of 2024. I'm not sure if this would help with that because, unfortunately, that virus lies dormant in our spine in the dorsal root
Yep.
ganglion. And so I don't know if this would filter it. Probably wouldn't filter it out, but I don't know if it would help my symptoms at all. But hopefully I'll never have to experience that again and I won't have to
Agreed.
experiment with this.
That's very painful.
Yeah, that was not fun. Okay, next slide, please. So why do other treatments work better after EBO2?
So when ozone interacts with the blood, it generates what's called a reactive oxygen species. And that essentially creates factors that makes membranes more permeable, makes the cell membrane more permeable. And it reacts to ions, nutrients, uptake of the medications, signaling molecules more efficiently. Um, Timing is a really big one with that too for permeability.
Mhm.
So immediate exposure to ozone in seconds to minutes, the signaling molecules start to increase. Short term, the membrane fluidity and transport activity changes. It can last hours. So like 2 to 6 hours roughly is kind of the realm there. And then longer term, so repeated treatments of ozone can induce actual gene expression changes, which can last days. So it's basically just the enhanced functional capacity of the cell.
Right
So
on.
just frequency of ozone dramatically increases the cell's permeability. So the cell's ability to uptake nutrients, give you basically less, it has been shown to give you less side effects of some medications and increase the effectiveness of it.
Right. And this is actually really good for my clients who cannot tolerate hyperbaric oxygen therapy for one reason or another. Dr. Moon and I have been collaborating quite a bit now for the last year. And so my clients who can't undergo hyperbaric oxygen therapy for one reason or another, I have them do the EBO2. And I'll typically have them do it like if I'm doing their procedure on Monday, I have them try to do it like Wednesday or Thursday the week before. If I'm doing it on Wednesday, I'll have them try to go on Monday for all the reasons Barry mentioned. Number one, It decreases our toxic load. So when I'm doing your biologic, which could either be PRP, platelet poor plasma, protein concentrate, it can be autologous conditioned serum, it can be your bone marrow stem cells. All those tend to have a more robust growth factor and cytokine, a favorable cytokine profile, which means that they'll have a better response in the body. So a lot of times with biologics, most of you who have gone through that with me know that the pre-habilitation is one of the most important aspects of this. I like to tell people, you're making the stuff I'm going to be injecting back into you, so make it good. That's only one part of it. You also want to create an environment of health. So when I inject this stuff into your spine, into your joints, your ligaments, your tendons, we're creating an optimal environment for those cells, for those growth factors, for those anti-inflammatory proteins to have the most optimal outcomes. So, but EBO2 can work with that as well, especially before the procedure. Also, after the procedure, a lot of my clients have noticed that if they're having some lingering effects from the anesthetic, doing EBO2 afterwards really helps them feel like they've metabolized the anesthetic much more efficiently. So, great option if you can't do hyperbaric, or even if you can do hyperbaric. I still recommend a session of EBO2 before the procedure, one or two sessions before the procedure, and then maybe one afterwards as well. So who tends to benefit the most from EBO2, Dr. Moon?
I mean, essentially anybody with a chronic toxicity. We've seen a lot of success with MTHFR genetic mutations due to their just inability or lesser ability to detox properly. Just people looking for overall general better health because it allows you to detox and gives you that, quote unquote, oil change for your
Mhm.
blood. And just anyone who doesn't have any contraindications to the procedure.
Great. And we'll get into that in a few minutes, what the contraindications are. I mean, like I can tell you from my own personal perspective, I love that have actually done this and I can share my experience. Um, the very first session we did was on a Friday afternoon. Dr. Moon was kind enough to opened his clinic for me on a time when I had off. But the whole experience, start to finish, was first class. I mean, your team is incredible, Dr. Moon. I felt very taken care of, very well cared for. And this is for my community too. Like before I send you somewhere, I'll only refer you to people I trust and that I've had a personal experience with. When I refer people out to other facilities, it's I'm referring you to areas and other facilities that are an extension of myself. So the trust you put in me, I extend that to my colleagues in the community, and I've built rapport with them, and I've also been to their facilities and have undergone these treatments. So uh, for me, being healthy and in relatively good shape, I still notice the benefit. That Friday afternoon we did the procedure, and that Friday night I slept solid. I mean, I'll never forget how well I slept because that was I believe it was in May, and we had so much going on the first quarter of 2025. I mean, we were working a lot, traveling for work, presentations, public speaking events. I mean, there was a lot on my plate, and that night I remember sleeping so well and waking up Saturday and just feeling great. And then the second time we did it was over the summer, and again another fantastic night of sleep, and just feeling good. And I got my labs checked. We did them 3 months apart because I usually get my labs drawn every 3 months, and my 3 month lab, my week after labs. Sorry, I did the labs the week after the EBO2 treatment, and my blood markers were great. My inflammation tends to be low from several other modalities I do, but what really impressed me was my lipid panel improving. So how do you see EBO2 fitting into the future of integrative and regenerative medicine?
I mean, you pretty much touched on it. It's essentially just prepping your body to be at its absolute optimum, decreasing all of the toxic load that we get over the years. I mean, just buildup of parasites, heavy metals. I mean, we're constantly breathing it in now. It's everywhere. So it's essentially just change that oil like you would in your car and for preventative maintenance and let your body, do what it needs to do.
Great. Yep. So here you go. Yeah, I just say that most everyone online or on this talk has our contact. This is Dr. Moon's contact information. That's his office phone number, his website, moonihc integrativehealthclinic.com, moonihc.com. Um, and like I said, I've been to his clinic and I've referred quite a bit of my clientele there. And we've actually referred friends and family to Dr. Moon, and the feedback has been tremendous. I mean, he's just an all-around extraordinary dude, and he really cares for his patients and takes excellent care of them. And I can't recommend him highly enough. There are a few other places doing this therapy, but I highly recommend Dr. Moon. I mean, it's first class all the way through. So if anyone on here has been there, you know. If you haven't been, um, I know you'll have a positive experience. So we got some questions here. Whoa. Um, let's see here. How do I? Oh, that all popped up. Okay. So does it matter if a patient is on blood thinners, Dr. Moon, if they're going to do this? Do you have them stop or can they just continue, or what's the
Yep. So
protocol?
we have them stop for 12 hours before, 24 hours preferably, but 12 hours before the procedure, because we do use heparin with the procedure itself.
Okay.
So they just have to stop for that day, and then they can continue the following day after the procedure.
So we didn't really get into contraindications. Would a heparin allergy be a contraindication to undergoing EBO2?
Yes, it can.
Okay. So
Yep.
important to note. Okay, great.
Yep.
What other what other contraindications are there to EBO2? So who is not a good candidate for this?
So anybody with like severe cardio instability, pacemaker, low blood platelets, low hemoglobin, women pregnant can't do it as well. So just to name a few, but
What about people with
very few
cancer?
people have an ozone allergy. Just go ahead.
Sorry. So what about people with cancer?
So we have had cancer patients do it. We just obviously with everybody want to see their blood panel beforehand to make sure that
Sure.
they don't have any of the major contraindications or make sure they have enough hemoglobin, red blood cells to do the procedure.
Right. What about clients with seizure conditions? Is that a concern?
We haven't had anyone yet with a seizure condition.
Okay. I mean, if someone had a seizure condition, could they undergo the EBO2?
You bet.
Yep. Yeah, because one thing about EBO2 that we might not have mentioned is that it doesn't filter out your medications. So if you're taking a
Right.
seizure medication, you can still do EBO2 and your levels of your medication are not going to drop. So that's one of the beautiful things about EBO2. That's how it's different from dialysis. Dialysis filters out everything, right? This is just filtering out mold, toxins, viruses, bacteria, microplastics, things like that. So anything, um, that's 100 kilodaltons or larger. So that's a great question. Also, another one of our members is asking, how does this help to manage MS or rheumatoid arthritis, or does it help to manage rheumatoid arthritis or MS?
So very big factor with rheumatoid arthritis, just helping remove all of the inflammatory issues, conditions in the body that can compound onto that. MS, it helps as well. Just we've had a lot of success with autoimmune conditions. So it's essentially comes down to removing those toxins, and then it also increases the cytokine production significantly. And that's essentially it downregulates an overactive immune system or it upregulates an underactive immune system.
Yeah.
So that's why increasing the cytokine production significantly can help with autoimmune
That's
disorders.
great. Yeah. So I would say that to the person who asked the question, it wouldn't be a treatment, but it could be an adjunctive modality to reduce your inflammatory load and maybe help your immune system be healthier, if you will, or be a bit more robust
You
without
bet.
the use of the drugs. So, but obviously, I mean, for rheumatoid arthritis and MS, you got to follow the advice of your treating physician. But it sounds like this could be a potentially great adjunctive modality to just help relieve the inflammatory load and maybe help with symptom control. So,
Yes.
another client's asking, how does sanitation work with the machine and the lines going in and out of the machine? It's a great question.
So
Yeah.
yeah, the lines don't actually go into the machine itself. So think of the setup as just an external set of veins and external liver, essentially. So think of the liver, or the filter is the liver. So no blood actually gets exposed to any outside factors at all, or does it pass through the machine itself?
Yep. So this is a great question, Rusty, because when I was doing this, that was my question too. And I've had several clients ask about it, but I've watched the whole system. The blood is only going through the tubes. So the machine and the machine parts don't actually come in contact with any blood product. So the blood goes through the filter, and that filter is disposable. It's only one filter per person. And all the tubes that are in the machine, they completely come out. So the machine is completely sanitized the entire time. There's no contact with any of the blood product. So, um, if you're comfortable talking about it, there's a question about what the price of a session is, or if you'd rather have them call and talk to you. Whatever.
Here, they can call, or they can DM us on Instagram, and yeah, we can go over those details.
Perfect. Okay. What are the questions? If you want to unmute and ask questions, you're welcome to do that. It's kind of nice having it in the chat because then everyone can see the questions too. So, like I said, for me, it's been a great experience. I'm looking forward to going back. Oh, how long does each session take? So,
So typically start to finish, hour and a half. So the entire procedure, yeah, plan on like hour and a half, but the actual ozonation is an hour. So you
yeah,
get an hour straight through.
yeah. I think when I was there, Barry, it was like an hour and 15 minutes start to finish.
Yeah.
So I'm sure it just depends on how long it takes to start the IV. I know
Yep.
the second time we went, I've got great looking veins, but they are not good veins.
A lot of valves.
Yeah, a lot of valves. So we started one IV and it just wasn't pulling blood. I mean, it was, easy going in, it flushed great, but then when it was hooked up to the machine to aspirate the blood out, it just wouldn't go. So before we gave up, I was like, I need to do this. So we were able to find a second vein that actually worked and was a giver. And that happens here too. I mean, when I'm doing PRP or bone marrow stem cells and I'm taking whole blood from a vein, sometimes we get an IV in and we can flush it and it's great, but when I go to take the blood, it just doesn't give. So um I would say at least for me, that was a rate limiting factor, but still it's like an hour, like you said, an hour and a half, but I think I was done in an hour and 15 minutes, both sessions. Hmm.
Because you're a beast. That's why.
I learned by watching you. Yeah. No, Barry, no. If there's no more questions, then I just want to thank you, Barry, for coming on and sharing this with the community. This will be recorded, so for people who couldn't watch this or who people who want to go back and hear this again, if you have more questions, you got Dr. Moon's contact information on that slide. Hopefully you screenshotted it. If you didn't, just go back to the Zoom meeting, which will be posted in our community. And then, Nikki, do you want to go back to that slide just in case people want to see it and they can
Yeah, you know what? I'm actually gonna put his information in the
in the
chat.
chat? Oh, great.
That
Perfect.
way they can just click on it and they have everything right there. So
Okay.
there it is right there.
Okay. Yeah, there's Dr. Moon's website there. So if you guys want to click on it and save it to your phone or your computer, you'll be able to explore more of what they offer at their center. Um, but again, it's world class, first class service all the way through. Incredibly kind staff. And as you all know, we love dogs. We have our puppies running around the office. Dr. Moon does the same thing. So
I'm dying with his background. I love
I know
Yeah, those
all the
little babies.
so
friendship. So he's a dog lover also. So
Yes.
yeah. But well, thank you all for joining. Thank you, Dr. Moon, for making time in your evening. Really
Thank
appreciate
you. I
you,
appreciate
man.
it.
Looking forward to coming back. I've got a couple people who'll be calling you that I actually saw today, so you'll be hearing from them. Again, it's part of my pre-procedure protocol and post-procedure protocol for the orthobiologics that I do here. So, it can be done in place of hyperbaric if you can't do hyperbaric, or it can be done in conjunction with. And I honestly think the best is to do both of them together. So, um, you get the best of both worlds and you'll make a very clean product. And then, this can only enhance the outcomes with these procedures. So
Any final questions before we sign off?
awesome. Thank you, everyone. Thank you, Dr. Moon. Everyone have a
Appreciate it.
great
Thank
night
you.
and we'll talk soon.
Sounds good. Thank
Thanks.
you.
Good night.